Welcome back to Daily Cardiology. And today, your ears are the real diagnostic tool. This is the Heart Sounds Challenge, where 11 classic murmurs and heart sounds stand between you. And the title of Cardiac Legend. I'll give you clues, auscultation locations, sound characteristics, and 4 options. You'll have a few seconds to guess before I announce the truth. Ready? Stethoscope on. Focus mode activated. Let's begin. You place your stethoscope at the right upper sternal border. You hear a harsh crescendo-decrescendo systolic murmur that radiates straight to the carotids. This one almost vibrates through your chest. Your options: A. Pulmonary stenosis. B. Mitral regurgitation. C. Aortic stenosis. D. Mitral stenosis. Think about the radiation and that classic crescendo-decrescendo shape. And the correct answer is aortic stenosis. This is the ultimate carotid radiating murmur. If you got that right, beautifully done. But don't celebrate yet. We're just getting warmed up. Let's move to something trickier. You listen at the left upper sternal border. S2 is widely split, and it stays split during inspiration and expiration. It doesn't budge, not even a little. Your options: A. Atrial septal defect. B. Persistent split S2. C. Innocent murmur. D. Pulmonic regurgitation. A split S2 that refuses to change. What does that tell you? And the answer is atrial septal defect, the legendary fixed split S2. If you nailed that one, you're paying attention. But I hope your ears are warmed up, because the next one lasts the entire systole. At the apex, you hear a blowing murmur that stretches across the entire systole. Beginning to end, it refuses to stop. Your options: A. Aortic stenosis. B. Holosystolic murmur. C. Mitral valve prolapse. D. S3 gallop. A murmur that fills all of systole. That's your giveaway. Correct answer: holosystolic murmur, usually from mitral regurgitation or VSD, ventricular septal defect. 3 down. Are your ears getting tired? Because we're not slowing down. Let's move to something gentler, but sneaky. You're evaluating a child or young adult. You hear a soft systolic murmur at the left sternal border. It's gentle. It disappears when they stand, and it gets louder when they lie down. Your options: A. Innocent murmur. B. Aortic stenosis. C. Mitral stenosis. D. Mitral valve prolapse. Soft. Positional. What does your clinical instinct say? And the answer is innocent murmur. Benign, harmless, very common. If you got this wrong, your pediatrician friend might tease you. Let's keep going before anyone finds out. Bell on the apex now. You hear a low-pitched diastolic rumble with a sharp opening snap as the valve flies open. It sounds like distant thunder. Your options: A. Aortic regurgitation. B. Tricuspid stenosis. C. S3 sound. D. Mitral stenosis. Rumble plus opening snap, a classic pair. The correct answer, mitral stenosis, most often from rheumatic fever. 5 questions in, and you're still here. Impressive. Only the sharpest listeners survive this far. But now, question 6 has a sound you will never forget. At the apex, you hear a sudden mid-systolic click, followed by a late systolic murmur. Here's the twist. It becomes louder when the patient stands up. Your options: A, mitral valve prolapse; B, aortic stenosis; C, innocent murmur; D, holosystolic murmur. Click, then murmur, louder on standing. That's your signature. And the answer is mitral valve prolapse, the classic click-murmur syndrome. 6 questions down. And if you're still crushing it, your ears might be tuned for greatness. But don't walk away yet. The next 5 questions will test whether you're destined to become a cardiac legend. Take a deep breath. Reset your thinking. Let's continue. You place your stethoscope at the left lower sternal border, then at the aortic, pulmonic, tricuspid, and mitral areas. You hear a crisp S1, followed by a clean S2. No murmurs, no extra sounds, just a calm, healthy rhythm. Your options: A, mitral stenosis; B, S3 sound; C, normal S1, S2; D, persistent split S2. Nothing extra, nothing unusual, just a perfectly behaving heart. And the answer is normal S1, S2, the sound every doctor wants to hear. But don't relax. The next sound is subtle, and missing it can change an entire diagnosis. You're at the pulmonic area, and you notice something unusual. S2 is split, but unlike the normal respiratory variation, this split stays constant during inspiration and expiration. Your options: A, normal split S2; B, persistent split S2; C, transient split S2; D, aortic stenosis. A split that refuses to change? Very suspicious. Correct answer: persistent split S2, often caused by conditions like right bundle branch block. If you caught that, your ears are sharp. But let's raise the difficulty. You listen at the apex with the bell patient lying on the left side. You hear a soft, low-frequency sound right after S2. It's a gentle lub-dub-dub, like a third footstep. Your options: A, innocent murmur; B, S4 sound; C, S3 sound; D, holosystolic murmur. A low-frequency extra sound, just after S2. What do you think? And the answer is S3 sound, the ventricular gallop, often linked to heart failure or increased volume states. 3 questions remain. Now the real test begins. You listen at the left lower sternal border and you hear 2 distinct components of S1, almost like lub-lub-dub. This happens when the mitral and tricuspid valves close at different times. Your options: A. Split S1. B. Split S2. C. S3 sound. D. S4 sound. Two-part S1. At the left lower sternal border. Should be ringing a bell. The answer is split S1, a classic finding when the valves don't close in sync. All right, this is it. The final challenge. One last sound before we determine your rank. You're back at the pulmonic area. This time, S2 splits during inspiration, but becomes a single sound again during expiration. A temporary split, disappearing with breath control. Your options: A. Atrial septal defect. B. Persistent split S2. C. Transient split S2. D. Wide fixed split S2. Split on inspiration. Gone on expiration. Classic physiology. The correct answer: transient split S2. This is the normal respiratory variation of S2 splitting. And that was the final heart sound of today's challenge. You made it through all 11, and now it's time to reveal your score. 2 to 4 correct? Cardiology intern, good start. 5 to 7 correct. Resident, strong ears. 8 to 9 correct. Specialist, impressive auscultation skills. 10 correct. Professor, teaching level mastery. 11 out of 11? Congratulations! You are a true cardiac legend. Comment your score below, challenge your friends, and hit subscribe for more quizzes from Daily Cardiology. Your journey doesn't end here. This is just the heartbeat of your learning. See you in the next challenge.